Hi, and welcome to the Educational Experience. I'm Chip Rogers, and thank you for being with us today. Our topic of discussion will be regulation and its impact on America's small businesses and large businesses as well. And we'll have a focus in this series on the new national health care law that was recently upheld by the Supreme Court. My guest today will start on my direct left with Misty Chalik. She is the Executive Director of the Coalition of Franchisee Associations, a group of franchisee associations, some of the biggest names in the business. We'll talk about that in just a minute. And to her left is Ben Domenech, and he is with the Heartland Institute, a senior fellow, managing editor and research fellow on healthcare policy news, which is a publication, actually, Ben, that I read quite a bit.
Good to be with you.
You do fine work. Thank you for being here. All right, so regulation. We want to start with the real basics here, because this is something that I've been involved in the political world probably almost my entire adult life. And every politician, every elected official tells us, well, we're going to jumpstart the economy by reducing regulation. But the fact of the matter is, regulation continues to grow. So explain to us at a very basic level what regulation is, Misty, and how it hurts businesses.
Well, in a very basic level, regulation is when Congress passes a law, they pass on the authority to different governmental agencies to interpret that law. And they interpret that law via regulation. Now, what we're seeing the problem is that the regulatory agencies don't have a lot of checks and balances. They don't have a lot of oversight to make sure they're actually carrying out the intent of the law that's passed. And so what happens is they're issuing a number of different proposed and finalized regulations without understanding the impact on the small business industry and the small business community, and they're not making sure that they're following the intent of the law. And recently, I'd say over the last several years, the regulatory agencies have had an increasing amount of power being given to them without any types of checks and balances. So they are able to promulgate laws that really exceed the intent of the initial law passed by Congress. And so those that don't have experience, running a restaurant or a small business or any type of business background are those that are mandating that these small businesses comply with regulations, so they don't understand the impact of what they're doing on the small business community.
And I guess the fear for a lot of us, Ben, as we think about regulation is, our system is basically founded on this pretty simple but perfect philosophy that you have three branches and that they must balance each other. So you have the executive branch, which is supposed to execute the law, but they're not supposed to make the law. And I think a lot of people, particularly a lot of small business owners, are saying, I don't recall voting for this law. I don't recall voting for anyone who voted for this law. Yet these regulations just continue to grow, and it almost is, for lack of a better term, unregulated, that the executive branch is just really injecting themselves where they probably ought not be.
In terms of the demands that the healthcare law places on businesses, particularly on small businesses, I think, some of the most tangible ones, the ones that have already been felt, are the requirements in terms of just keeping track of things to a much greater degree than you've ever had to before. This was an aspect of the law that actually ended up being struck down by the Congress after they came back into session, in terms of something that would have required an enormous amount of tracking in terms of for tax purposes, the various expenditures that each small business had. That's just sort of one small example of it, but in the broader scope of things, what we really see is a level of regulation on not just small businesses, but on the American people, in terms of the demands that the IRS is going to place on them for new levels of reporting, for new forms that are going to have to be filled out by every American, and a number of other requirements that are within the law that people are only just starting to learn about.
Yeah, one of the things you just referenced there was the 1099 requirement. Exactly. That said that you were going to have to start invoicing everybody that you did over $600 of business with, yes, back and forth. Luckily, because of massive outcry, Congress changed that, but that's just one example of so many things that are being added in the healthcare law and outside the healthcare law that has become a nightmare for businesses.
Exactly, and when we are up talking to the legislators that are elected by the people, they were not even aware that it was a two-sentence provision in over 1,000-page bill. So these
So they didn't read it.
They didn't read it, but they look over what they look over, and then they pass something that they don't understand everything that's in the law. And honestly, if somebody hadn't caught that, that would continue to be the law of the land. So fortunately, that was caught. The business community did oppose it very vocally, and that was repealed from the law.
Ben, well, you really touched on this a moment ago. Sometimes when we think of regulation, we often think about what is the direct cost to the business. But one of the things we don't think about is the massive amounts of paperwork necessary simply to comply. See, the statistics show us that the federal registry, which is where all these regulations go, 42,000 pages long now, costing businesses $55 billion. But here's the key part: 114 million hours a year just to fill out the paperwork.
Yeah, and that's the thing that I think people really underestimate. When Washington decides to keep track of something, they often do so from a perspective of benevolence, of, we want to keep track of something in order to make sure that people aren't being harmed in this way, or that we're helping the right people in that way. But really what it turns into is an excessive burden on businesses across the country, particularly on small businesses where the margin there is so small anyway, between being able to make a profit, keep your doors open, and losing in terms of your ability to compete within the marketplace. I think that the 1099 example is a good one, but here's one of the differences I think there, and some of the other regulations that we see in the law. That was one that was really hanging over everybody's heads because so many people were affected by it. In a lot of other cases, there are regulations within that law that are only going to affect people who are in certain types of businesses, people who are in terms of the taxes that are within the bill. We're all familiar with, I think by now, the tanning tax and some of the other things that are in place within there. It's funded in a variety of ways, but I think that one of the ways that people should think about it is just the regulations that come out within a law, whether that law is the healthcare law or anything else that comes from government, are really just the starting point. They're opening up the door for the government to have access to and regulatory power over a whole new area of your life. And so when you view that in sort of the long term about what Washington is going to do, it isn't just that standalone law, it's the steps that are going to follow it. Now that they're not going to track the 1099s, for instance, what's going to be the next regulatory step that they take to try to get that information through other means? And that's something that's always a concern for businesses.
And when it comes to the franchisee community in particular, when you're talking about paperwork burdens, a big issue that we have in Washington, if you go in and you say you represent the XYZ Franchisee Association, let's say it's the Burger King Franchisee Association, you hear Burger King, you hear Subway, you hear Quality Inn, Comfort Inn, you think it's a big corporation and they're the ones that are bearing the burden of these paperwork mandates. But in fact, when it comes to things like the paperwork, anything that we've experienced, menu labeling, the healthcare law, you name it, it's really being put on the backs of the franchisees, who are the small business owners who don't have the time nor the resources to comply with these mandates.
I think you bring up a good point, because people see these big names that you referenced, and they think, all right, they got some corporate headquarters in New York, and everybody's, half the people are there just to fill out paperwork. But in reality, when it comes to the healthcare, these are the guys that put their life savings to start these, what are essentially small businesses. They're the ones hiring the 10 or 12 employees. They're the ones that now are going to face even more regulation from the government on this healthcare law specifically, but a lot more than that.
Absolutely.
One of the things that you mentioned there, you talked about the requirement to put on menus the various calorie counts. Now, this is something that was put into the healthcare law, from folks in Washington who think that's going to have an effect. Now, every bit of research that we have into it that's been done by obviously nonpartisan individuals that looks at this actually finds that it makes a negligible difference in terms of the eating patterns of most Americans, whether they see the calorie label or not. They still tend to eat basically the same way, except when they put that requirement in there, it puts an enormous burden, particularly on franchisees, but also on any local deli, any local business that wants to expand. Essentially, when you reach the store cutoff, you say, do I want another store so that I have to qualify for this, where I have to hire additional people to check every menu item, and if I ever want to change my menu, I have to recheck it. I have to look at it again before I can actually put it on. That's a judgment that a lot of small businesses will look at within the food industry and say, I don't want to bear that cost. And that leads to lost jobs for the whole of the economy, and it hurts the rest of us. And so I think the way to sort of understand these things is, again, there's something that is undertaken from a noble perspective of, well, maybe if we just require them to put these numbers on there, people will make decisions that lead to them not eating as many fatty foods. But the reality is, most people know that a Snickers bar isn't that good for them. And they're going to know that whether you put a new number on it or not that says so.
Yeah, there's certain places where you go to eat because it's maybe advertised as comfort food. You don't care what the calories are.
Absolutely.
Exactly.
We got to take a quick time out. We'll be back right after this. We're talking about regulation and its impact on business with my guest, and we'll be back right after this quick time out. Welcome back to the Educational Experience. I'm Chip Rogers, and again, my guest this week as we talk about regulation, Misty Challey, the Executive Director of the Coalition of Franchisee Associations, and to her left, Ben Dominich, and he is with the Heartland Institute, for lack of a better term, a think tank. And Ben, tell us exactly what Heartland is and what you guys do.
Sure. The Heartland Institute is a libertarian think tank based in Chicago. It's been around for almost 30 years and is very active at the state level, particularly in arguing for free markets and for consumer power across a number of different policy areas. You can find our research at heartland.org, and we cover a number of different issue suites. We're particularly active in the education space, in the healthcare space, and on tax issues and things of that nature.
So for a small business owner, the Heartland Institute is their friend, if they want government to stay out of their lives.
If they want government to stay out of their lives, absolutely. If you want favors from government, then maybe look somewhere else.
Misty and the Coalition of Franchisee Associations, I've been with you guys and done some work with you for years, and I know you're a wonderful organization that represents a lot of these big name small businesses, right?
Exactly. And and that's where kind of the rub comes. And we're doing a lot across the country and in Washington, D.C. to help those representatives understand the difference between what a franchisor is, what a franchisee is, and the different roles that they take. But CFA is the National Trade Association representing franchisees and franchisees only. We have 18 member associations, and our member associations are those franchisee associations. So for example, our members include the Domino's Franchisee Association, the Subway franchisees, 7-Eleven franchisees, Burger King franchisees, Meineke, Supercuts, Dunkin' Donuts. I could go on, but we have doubled our membership in the last year, and so we're really excited. And what we do is we provide information about government relations. Obviously, healthcare is on the top of all the franchisees' minds, and also we do a lot of information sharing, and we do a lot of education for those franchise owners on everything from how to choose the best site for a new franchise to how to comply with the healthcare law. So what we're doing is trying to provide information to franchisees who wouldn't get that information otherwise.
So, and I'm glad both of you are here. Heartland represents the guys who want to keep government out of the business, and the businesses represent the guys who want to keep government out of business for the most part.
For the most part.
On that topic, NFIB, everybody knows who NFIB is. They represent a large number of small businesses, the National Federation of Independent Business. Their poll they did this last year, they asked businesses, what is the number one concern you have? Now, the number one concern that across the board, it wasn't close, was slow sales. Now, we understand that. Number two was not taxes that you might think. It wasn't immigration. It wasn't not able to find a qualified workforce. It was regulation of small businesses across this country. 19%, which made it the number two choice, said that regulation was the single biggest issue that they face. And I know you study this, and of course, Ben, particularly with the healthcare law that is now being implemented, may be the biggest regulation that the country's ever seen. But as you read through this law and look at all the points, you got to be looking at it saying that's going to kill a lot of businesses.
It's not just that it's going to kill businesses, and it is going to hurt them very much, but it's also going to prevent them from expanding, and it's going to prevent them from starting in the first place. It's going to take, for young entrepreneurs who are just coming out of college, who are maybe have an idea or want to start something, it's going to bank in a number of significant costs in terms of just getting off the ground. And really what I think that we're seeing when we sort of step back and look at the way that this is going to impact the economy is that initially there was thoughts on the part of the NFIB and several other places that this was an idea where the administration could have some give and take, where they might have some negotiating power to give small businesses a leg up or give them an ability to tackle healthcare costs, which is a rising concern for them. And instead, as the law sort of went through its various iterations, it became clear that not only was the White House not interested in listening to the small business community, in fact, the NFIB obviously was the main filer in the lawsuit that the Supreme Court ultimately took up. But in terms of the crux of the issues that were of concern for small businesses, it became clear that even the plans that they were currently offering their employees, if they were offering anything, were no longer going to be sufficient to meet the various requirements and regulations put in place by the administration. And that's something that I think we all ought to be concerned about in terms of the result of this ending up with more people going on to Medicaid and other taxpayer-funded programs as opposed to getting coverage in the private insurance market, coverage that franchisees and that small businesses were already offering to their citizens, to the citizens who were working for them. I think that's something that is a hallmark of government finding additional problems in the solution that it tries to create. And I think in this case, they tried to create a solution that would shift some of these burdens off of small business and ended up just creating more regulatory burdens and ultimately more economic burdens for starting one in the first place.
That's the track record.
Take, for example...
All good intentions end up in more regulation.
Exactly. Exactly. I mean, take, for example, the definition of what a small business is. If you hit that 50 full-time equivalent threshold, and we can discuss this later, but you're adding in all of your part-timers and your full-timers. Once you hit that 50 number, you're no longer a small business. Well, you look at a lot of the small business owners that CFA represents. If you own more than one franchise, you're now no longer a small business. I mean, the average number of employees, say for a Burger King, is 30. And you have so many part-timers because it's all a lot of people's first jobs. They're going in after school. I mean, they're all counted towards that. So if you own more than one Burger King, you are no longer a small business and you must comply. And I think that it just reflects kind of a current lack of understanding of what a small business really is. And again, you hear the big name and you think that you can afford it, but in reality, they are the ultimate small business owner, and they can't absorb the cost of these mandates.
And I want to touch on that just for a second, Ben, because I know kind of the Heartland philosophy, and that is that really the government ought not be in the business of picking winners and losers.
Yeah.
I've always thought that when government sets an arbitrary number, they're essentially doing exactly that. They're saying, well, if you're below this number, we think you're too small to have to comply with our onerous regulations. But if you're above this number, we think you're big enough to actually spend all the money to comply with our regulations. In a way, that is picking the difference between winners and losers. And
Absolutely.
As you indicated earlier, what happens when that business gets to 45 employees and then they say, I don't want to expand because if I do, that subjects me to everything that the government wants to throw on me.
What we really see, and just to sort of step back and look at the philosophy of this, is the creation of enormous marginal costs in terms of what you lose by getting bigger, by being more successful. You see this within the states when it comes to the regulations that they put on businesses. You see it, as you said, at the federal level with the healthcare law and in terms of the burdens that they create, but you also see it at the individual level. A good example of this is to look at the level of entitlement programs, of offerings from the government in terms of free money, which comes obviously from the taxpayers, through the various programs that are offered. Currently in the state of Pennsylvania, just to give you one example, a single mom who makes $29,000 a year should never make $1 more than that, because the instant that she does, she will cease to qualify for a number of programs. In order to make enough money to make up for the lost revenue that she would have by making more money than that $29,000, she'd have to have an increase in salary to almost $60,000. Of course, that doesn't exist within the existing marketplace, and so the reality is people will always stay at that level. The same is true of small businesses, which is that when they look at this evaluation process and they say, should I get a little bit bigger and have to become subject to all of these new regulatory burdens, I'm going to have to hire another lawyer, I'm going to have to hire another insurance aide, I'm going to have to hire somebody to help me to do this and do that, to fill out all the paperwork and to make sure that I'm compliant. Instead, they'll just say, you know what, I'm content where I am. And even if my product is successful, even if I have the ability to buy another Burger King or to put my family in a better position, I'm going to stay at the threshold that I am. And what you really see there is a stagnation across the economy at a certain level that says that if you are ever going to rise above this level, you're going to have to pay all of these costs that we've put in place, not so much with the mind on you, but with the mind on who's big, who's going to have to pay the freight in order to abide by all these different regulations. Only big business can afford big government. And that's one of the things that I think you're going to see here, that small businesses are going to be the ones who are the most squeezed by this law and this approach.
It's almost like the message is, we want you to experience the American dream up to this amount.
Exactly.
We don't want you to have an American dream after that.
Exactly.
Speaking of dreaming, we're out of time. We can't wish the clock any longer. It has cut us off. But in our next episode, we're going to really drill down and talk more about the national health care law, which is termed oftentimes as Obamacare. I understand he doesn't even mind that anymore, so I guess we can say it. But we will talk about that and how it impacts your business and your future. So for my guests, it's Ben Dominich, thank you for being with us, and Misty Challey. Join us again next week, and if you need to contact me, you can do so, chip@AAHOA.com. That's chip@AAHOA.com. Thanks for watching.